Thank you so much. That was great. I appreciate you.
All right, Ms. Bell, you did awesome today.
See you next week.
All right, you be safe going home.
Okay, goodbye.
Oh, hey, it is Thursday. It's time for Therapy Thursdays. Come on back with me.
This is our first episode of Therapy Thursdays. Where have you been?
Yeah, sorry. That's kind of how life goes around here. So, sorry guys. Welcome to Therapy Thursdays. This is our debut segment, like she said, on Louisiana Living. I'm Dr. Jerry Yarborough, and this is my sweet wife, Angela. I'm a physical therapist, and we are the owners of Fyzical Therapy Balance Centers of Ruston and Jonesboro, Louisiana, and soon to be El Dorado, Arkansas.
We're in Ruston today, but why don't you tell us how we actually got here?
Okay, well, I've actually been doing physical therapy for about 27 years, as you know, and about 19 years ago, I opened my first clinic in Jonesboro, and offered good therapy down there, had good service, and then we live in Ruston. Angela's from Ruston. She's a homegrown girl, and I've been here about 26 years, and we really wanted to bring this quality service to Ruston. So we opened the Ruston Clinic about 7 years ago, and soon we'll be even opening a location in El Dorado, Arkansas. Physical is spelled different because we are different, and you know, our motto is to help people love their lives. That's our passion. That's our goal, is to help people love their lives. So we are the area's experts in balance and back pain. So we would like for you to come and visit us at 1701 Commerce Street right here in Ruston. So kind of what we're doing with Therapy Thursdays is we have a desire to really educate the community on different medical diagnoses and how physical and occupational therapy can help them overcome physical conditions that affect their level of life and their ability to love their life. So that's what we're going to do on Therapy Thursdays, and we hope that you join us.
Call us at the number below or visit us online.
So welcome back to Therapy Thursdays here on Louisiana Living. I am Dr. Jerry Yarborough, physical therapist, and this is my sweet wife, Angela. And we're the owners of Fyzical Therapy and Balance Centers of Ruston and Jonesboro, and soon to be El Dorado, Arkansas. So what we're doing here on Therapy Thursdays is we are here to educate the community on different physical conditions or impairments that affect their lives, and how physical and occupational therapy can help them overcome those impairments that are hindering their everyday lives.
So one of the questions I get asked a lot is, what is the difference between occupational and physical therapy?
Okay, first I'm going to start off with similarities, and that is that we're both licensed by the state. We both have extensive training in the examination and treatment of different physical conditions and impairments that affect people's lives. Now, physical therapists, we are the movement experts, and occupational therapists, they are the experts in fine motor movement and helping people in their occupations, whether that's at home, in the workplace, at school, or in their community.
So what kind of problems would a therapist help with?
Therapists can help people that have been diagnosed with neuromuscular problems such as Parkinson's, muscular dystrophy, multiple sclerosis, after they've had a stroke, pain anywhere in their body, pain, neck, shoulder, and post-surgical, like after a hip replacement, knee replacement, shoulder replacement, or just orthopedic surgeries, and even sports injuries.
Okay, so where would you go to have that?
So physical and occupational therapists work in a number of different settings. They may be in an acute care hospital. They may be at a school or an inpatient rehab, or even nursing homes have like skilled nursing facilities. Sports teams, many of them have therapists also. Or like here at Fyzical, we're an outpatient freestanding therapy center.
So do you need like a doctor's prescription or a referral to come?
Actually, in the state of Louisiana and Arkansas, physical therapists are under what's called direct access. So patients do not require a referral or a prescription to come and be evaluated and treated. Occupational therapists, they can do an evaluation and then they talk with the primary care providers before they finish out their treatment. So come back in our next segment. We want to give you a good takeaway today. And just remember, here at Fyzical, you can catch us on our Facebook or YouTube.
Or call us at the number below or visit us online.
Welcome back to Therapy Thursdays here on Louisiana Living. I'm Dr. Jerry Yarborough, and this is my sweet wife, Angela. I'm a physical therapist, and we are the owners of Fyzical Therapy and Balance Centers of Ruston and Jonesboro, Louisiana, and soon to be Dorado, Arkansas. So we're going to jump right into your takeaway from today's segments, and it's on fall awareness. We're just ending National Fall Awareness Month, and let me tell you, falls are a national epidemic.
Yeah, I was really surprised when you told me like the number one cause of death in ages 65 and over was falls. I was thinking cancer or something, but I was really surprised.
Right, I know, and actually 1 in every 3 people over the age of 60 have a fall every year. And every 11 seconds, someone falls, and every 19 minutes, someone dies from having a fall.
So what's the good news?
The good news is that it is preventable, and we're gonna come right out here and start showing you how you can help prevent a fall today.
So there are hundreds of different exercises that we can do at home, but we're gonna ask Dr. Jerry to give us his top 3.
All right, awesome. The first one we're gonna do is sit to stand. So to be safe, I want you to scoot to the front of your chair. Your feet should be shoulder width apart, and I want you to try to stand up without using your hands. Okay, up and down. You're gonna do that 10 times. If you cannot do it safely without using your hands, please use your hands. Then next, we're gonna come over here to a sturdy surface. Again, hold on if you need to for safety. And we're gonna do heel raises. So you're raising your heels up and down. And then lastly, we're gonna turn and again, hold on if needed. We're gonna do single leg stance. So you're trying to stand on one leg for at least 10 seconds and then do the other leg. All right, so those are the top 3 exercises I recommend to help you maintain your balance and remain safe at home. All right, so you guys try those exercises at home. If you have difficulty doing any of them, then you may need a little more help. And here's something else for you to consider. This is a fall assessment. If you are fearful of falling, if you have had a fall in the past year, if you use a walker or have trouble even standing and have to use your hands, if you say yes to either or to 2 of those, then you need help. You call Fyzical and we can offer you a free fall assessment.
Thank you guys for joining us. Come back next week when we're talking about back pain, or call us at the number below or visit us online.